Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. I just want to start off with some of our figures from yesterday. What is the latest figure that we have?
In terms of first dose vaccination, that is for people 18 years and over, we are currently at 161,886 persons who would have received their first dose of the COVID-19 vaccine. That, by our estimation, would be about 33.3% of the adult population. And in terms of the second dose, we currently have 18,526 persons who would have received their second dose of the vaccine, and we can consider them now to be fully vaccinated. In terms of regions, we continue to see a lag in Region 10. There have been a slight improvement, so they are now at 10% of their adult population. And on the other hand, in Region 6, for first dose, we have seen that Region 6 is now at 40%.
Okay. All right. That's very good. In terms of Region 4, where are our busy sites? Because I know we have a lot of sites around the place, but what are some of those that are probably busier than the others?
So the sites where we're seeing quite a lot of people are really in Georgetown, but we do have sites on the East Bank, we do have sites on the East Coast. We will be doing a lot more outreach work this weekend. I know the teams in the different regions have been planning outreaches, and so over the weekend we expect that there will be many more sites. On average, we are hoping to operate close to 100 sites, and so, you know, people on the weekends, they have a little bit more time, so perhaps we'll see better uptake during the weekend.
All right. In terms of monitoring and so on, where are our hotspot areas?
Well, in terms of testing, over the last 24 hours, we would have seen that there are 192 persons who tested positive. And when we look across the different regions, we're seeing hotspots emerging in different places in different regions. So Region 3, we continue to see cases around the Tushin area, Region 4 on the East Bank in Diamond. In Georgetown here, we're seeing cases in Kitty, some cases in Sophia and other parts of Georgetown. On the East Coast, again, some cases around the Mont Repose area. In Region 6, we've seen cases in New Amsterdam, and in Region 7, we see cases around the Bartica area. Region 10, we've seen a lot of cases in the Amila ward area. So there are different places where we have noticed increase in cases, and we continue to monitor them.
All right, Minister, recently I would have read about, the headlines are glaring whenever you have a death. And one of the things that I believe persons are forgetting is that you still have to deal with comorbidities, but they're COVID-19 related deaths. Could we talk a little bit about those? I also recall that in terms of the numbers that I've been hearing some numbers. Are those correct?
Well, we are getting a number of persons dying. Once you have hospitalization, a percentage of those persons would end up in the ICU and would die. So we keep repeating that. I don't know how many persons have been paying attention to it, but we keep repeating it because unfortunately there are some people who would get very sick when they're in the hospital and they would die. Now, initially when we start monitoring this, we noticed that older people with a lot of comorbidities were more at risk and therefore they become sick very quickly. They get into the hospital, and a lot of them end up in the ICU. And some of them, unfortunately, would die. That pattern is changing because what we've noticed now is about 63% of our over 60 population has now been vaccinated, at least with the first dose of the vaccine. And we'll encourage all of those who got their first dose to make sure that they get their second dose of the vaccine. Because unless you have both doses, you're not going to be fully protected. Now, what we have noticed over the last couple of weeks is that we have seen a change in the mortality patterns because we're seeing persons who are between 50 and 40. We've seen quite a few cases in that age category. We have had a few cases in the 40 to 30 age category, and we have had about 3 cases in the 30 to 20 age category. So we have to be mindful that this is no longer a situation where it's just older people. We're seeing different ages, and this is something, a trend that has also been observed globally. So it's something that we have to be mindful of, and if younger people or more active persons thought that they would only get the milder form of the disease, well, now, I mean, the new information that we are getting should tell people to be more cautious, and hopefully we can avoid the hospitalization. The other way to avoid hospitalization is to ensure that people come out, get their vaccines, get both doses of their vaccines, so that they can be fully immunized and protected.
All right, and just a bit of reminder, I know that the ministry is working along with private entities and so on, and you companies can organize to have their employees vaccinated as well. That is open.
Yes, that is still there, and we want to continue those partnerships. So we've been working with a number of companies. So those companies who would have organized for us to get the first to do the first dose of the vaccine, we'd like them now to do the second dose so that we can make sure that we immunize those working population.
All right, Minister, thank you. I wanted to talk to you about the Diamond Hospital. Since it was upgraded, how has it been managing as it relates to COVID-19? And in particular, is it still being used as an isolation unit, institutional isolation unit?
Well, Diamond Hospital, we have a hospital and we have another building that is within the hospital compound. So the building within the hospital compound, there are 2 sections to that building. One section is being used to house COVID patients that would need institutional isolation. And the other part of it, we have some of our doctors who are on call. So we continue to use it in this way. We don't have a lot of people right now for institutional isolation, but if there's a need, that section of the building would continue to be used as the institutional isolation space. In terms of the hospital functions like any other hospital facility. We have outpatients department, and with the new work that we have done there, we have a waiting area that is outside to reduce the congestion within the hospital itself. And services have returned to normal. So apart from the inpatients facility, we also have outpatient as well. So for both of those services, they're back to normal. Very shortly, we will start doing minor operations there as well. So these things, we're returning the services and making sure that people can come there and get service as quickly as possible. In addition to that, with the reopening, we have added additional capacity to test for COVID-19 patients. And so they have their own PCR machine, and they're able to do those tests there as well.
All right. If I can quickly follow up with regards to the other smart hospitals, I know Lenora is there. It's being refurbished basically, and then the others in Parmakatoy and I think another region.
So the other three, well, there are three hospitals right now where the contracts have been given out, and they're at various stages of construction. I've been able to visit the one at Mabaruma recently, and to observe the works that is going on there. And myself and the High Commissioner from the UK, because as you know, the UK government is funding this project, we were able to visit and have a tour and see what's going on. And hopefully we'll get that project completed on time.
All right, Minister. We said we wouldn't keep you long today, so I just want to thank you. And before you go, we know that today we're celebrating Eid al-Fitr.
So I just want to wish our Muslim brothers and sisters happy Eid Mubarak, and not only to the Muslim community, but to all Guyana.
All right, sir. Thank you so much for speaking with us. All right. Well, that's it for today's COVID-19 update. Of course, we just spoke to the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.